Experts say Nigeria's overwhelmed emergency care system could find a crucial ally in artificial intelligence. With severe shortages in personnel and resources, AI presents practical solutions to save lives and improve response. A key application is intelligent triage. AI-powered call centers and apps can guide callers through emergency first aid while prioritizing cases based on severity. This can reduce critical delays and human error in a system where coordination is often weak. AI and health professionals also agree that predictive analytics could allow for smarter resource allocation. By analyzing data on accidents, disease outbreaks, and admissions, AI can forecast emergency hotspots. They say this enables better pre-positioning of ambulances, blood supplies, and staff during a high-risk periods like festivals or floods. Within hospitals, AI clinical support tools can help doctors rapidly diagnose life-threatening conditions like stroke or sepsis, especially valuable where specialists are unavailable. International journalist Eden Harris joins now for expert perspectives on how AI can fill gaps in Nigeria's emergency care. It's good to have you with us. Welcome to Newsday.
Thank you so much for having me.
All right, so let's get into it. So why is AI raising wider concerns in Nigeria's medical field so far?
Yeah, so the death of Chimamanda Ngozi Adichie's twin son has put Nigeria's healthcare system under a harsh spotlight. Lagos-based Eurocare Hospital denies wrongdoing, and it has sparked questions about emergency care, medication safety, and whether the medical system is equipped to serve its people effectively. After Adichie's family representative claimed that the hospital gave her son too much sedative, which allegedly resulted in him going into cardiac arrest. So when that story came out, I reached out to Zimbabwe-born U.S. heart surgeon to answer the question, how can AI fill the gaps in Nigeria's healthcare system?
So what critical gaps do you think AI would, close when it comes to emergency care in Nigeria?
The critical gaps that AI could help close would be being a resource for helping to better help nurses in Ghana or even Nigeria log their notes, and that will actually help them when it comes to AI assistant documentation, because it will help them address challenges with workload and nurse-patient ratio. So for a company called InstaRad, which digitizes radiology departments in Africa, they're using AI to become like a 24/7 secretary, like an assistant, which helps them analyze those critical documents to basically help doctors have a faster turnaround in reporting. And this helps doctors move fast when timing is critical.
All right, Eden, where do medication and dosing concerns come in, you think?
Yeah, so when I spoke to Dr. Kelby, he told me there's a lot of bias in dosing, so it's important to get dosing right. He said that medical trials are mostly done on the Caucasian, Hispanic, and sometimes even an Indian population. It's rarely done on Afro-Caribbean populations, and that's his worry. He explained that African children may process medication differently from white children in the U.S. or the U.K., meaning dosage based on Western standards can sometimes carry serious risk if applied without adjustment.
So where does AI come in terms of preventing all of these kinds of medical errors? You talked earlier about the what happened during the sad incident of Ngozi Adichie's twins. Where does AI come in preventing this?
Yeah, so to prevent medical errors, according to Dr. Kelby, with AI, you can use that along with federal regulator tools to de-risk the population in Nigeria by creating digital twins. So he basically told me by taking someone's genetic profile, that they can create a replica. So when you're using AI to treat a kid in Nigeria compared to a child in America, that AI would basically think of that Nigerian child versus an American or Caucasian child and would have a different kidney clearance, which will produce the drug for the doctor.
Indeed, Eden, as you already know, AI is an evolving technology. So how is it already being used in African hospitals, and what are the prospects here?
Yeah, so as I mentioned earlier, in Ghana, they're currently exploring using AI to help with patient logging, which allows them to spend more time with patients when doctors and nurses are busy. I know currently in Nigeria, there are over 230 million people. So naturally, doctors will be overwhelmed, and naturally, doctors will take longer than a population that has lesser people to assist. So using it for charting, and using it as a personal assistant will help them move patients through the queue faster.
And we know that there are a lot of myths that make a lot of people skeptical about adopting AI. Why do you think some people are wary of this technology, especially in African healthcare?
Yeah, so I spoke to Dr. Kelby, and he basically said that a lot of folks are pretty wary about people from the outside coming in. You know, there's a deep concern that foreign-led AI projects could repeat colonial patterns, which could just like extract data and just pretty much impose solutions that really don't help Nigerians or Rwanda. And speaking of Rwanda, the Gates Foundation and OpenAI just announced a partnership to help bolster Africa's healthcare system with a $50 million initiative called Horizon 100. Rwanda will be the first country to participate in the program, but that partnership was met with backlash. According to reporting from Business Insider Africa, one social media raised the concern, quote, "The enemy will come as an angel in light," referencing colonial behavior.
Indeed. Now, what will an African-led solution look like going forward, you think?
So, while Dr. Kelby didn't comment specifically on the Gates Foundation new initiative, he did say that anyone coming into Nigeria, or anywhere or in Africa, carries a colonial sense, and he believes that Africa is a gold mine and that other people can't come in and take it. So it means having Africans at the table, actually listening to people who understand their population, because that's where the real solutions will come from.
So what would that solution look like? What would success look like? And who are the people, the stakeholders you think would be responsible for making this happen?
I think there isn't one person or just stakeholders. It's a collective. Throughout the interview, Dr. Kelby kept asking how can I help? How can I help? And I asked him, I was like, if you could ask Africa's richest man, Illegal Dangote, to support your deployment of AI to improve Nigeria's healthcare system, would you? He said, absolutely. He told me everybody wants to make good. I mean, everyone wants to do good for the people, because what matters is leaving behind a legacy. And he also said, because money isn't an object for Dangote, it's about him leaving the world better in which he left it. So, Mr. Dangote, if you are listening to this call to action, Dr. Kelby says this could be Nigeria's atomic moment in healthcare.
Indeed, all for humanity. Eden Harris, international journalist, would like to thank you for your thoughts on AI and Nigeria's emergency care.